Today, my topic is going to be on breast cancer. As I share my screen, I know this is a very touching topic for a lot of people. There's a lot of walks that are going on, a lot of awareness as it comes to breast cancer. So we're going to touch on that a little bit today. So what is breast cancer in women? Breast cancer develops when cells in the breast grow in an abnormal and uncontrolled manner. Over time, these cells can form tumors. In most cases, these tumors are benign. Some people do get very anxious when they find some kind of lump or something, but sometimes it is benign, meaning that they are non-cancerous and do not spread to other parts of your body. But sometimes cancerous tumors do form. The cells that make up cancerous tumors are malignant, meaning they can invade neighboring tissues and may even spread to distant parts of the body. The breast is made up of a combination of glandular, connective, and fatty tissues. The glandular tissues contain milk-producing glands and ducts, which transporting milk from the glands to the nipple during breastfeeding. While cancer can develop in any of these breast tissues, it is most commonly occurs in the lobules and the ducts. And this is a picture of what a breast looks like when it has a tumor. The causes of breast cancer is when the DNA in the breast cells mutate and change, disabling specific functions that control cell growth and division. What are the risk factors of breast cancer? Risk factors are characteristics and conditions that increase your risk for a disease. Breast cancer risk factors include some you cannot change, but there are risk factors that you can change to help lower your likelihood of developing breast cancer. Doctors don't know why some women with risk factors don't get breast cancer and why others with no risk factors, other than being female, do not get breast cancer. Still, you can make certain lifestyle choices to try to lower your risk. Risk factors, for the most part, they say 55 plus, but we're learning that there are younger women now that are getting breast cancer based on genetics. Breast cancer is 100 more common in women than men. About 287,850 new cases of invasive breast cancer have been diagnosed in 2022, will be diagnosed in 2022. Family history, you become twice as likely, and of course, genetics, and I'll go more into these things. Life habits, risk factors that you can change. Alcohol use. Research suggests that women who drink one or more alcohol have a 7 to 10% increased risk of breast cancer. Your weight. Breast cancer is on the list of diseases and conditions caused or worsened by being overweight or obese after menopause. Why? Your ovaries stop making the female sex hormone estrogen after menopause, so most estrogen comes from fat tissue. The more fat you have, the more estrogen you make, and estrogen feeds some breast cancers, causing them to grow. Sedentary lifestyle. Physical inactivity put individuals at a higher risk for breast cancer. So the American Cancer Society recommends that you aim for 150 to 300 times of moderate intensity exercise, such as brisk walking, or 75 to 150 minutes of more intense activity, like running each week. Your reproductive history. Women who haven't had children are at a high risk, or those that have after the age of 30. Early menstruation or late menopause. If you started menstruating before you turned 12, that also puts you at a high risk. No history of breastfeeding. If you breastfeed, your risk of developing breast cancer may be reduced, especially if you did it for a year or longer. Hormone intake. Some birth control methods use hormones, which can up breast cancer risk. These may include oral contraceptives, birth control shots, birth control implants, IUDs, birth control skin patches, vaginal rings. Risk factors you can't control, your gender. While men may develop breast cancer, women are at a high risk. Your age. Women over age 40 are more likely to develop breast cancer, and risk increases as women age. Your family history. If your mother, sister, or daughter Even your father has breast cancer that increases your risk, or if they even have the genes, which is the BRCA1 and the BRCA2. Other risk factors is your breast density. Dense breasts have more glandular and fibrous tissue and less fatty tissue, and this is known to increase a person's chances of developing breast cancer. Radiation to your chest, if you had that for any reason, that can increase your risk as well. Your race and ethnicity. White and Black women have the highest risk of developing breast cancer in their lifetime. Asian Pacific Islander and Hispanic Latino women's breast cancer rates fall in between two major groupings, while American Indian and Alaska Native women are on the lowest end of the risk. While white women are more likely to develop breast cancer than Black women overall, they tend to be diagnosed at an older age, between 60 and higher. Black women have the highest breast cancer rates among women under age 40. Black women make up a higher percentage of triple-negative breast cancer cases. What are the symptoms? You may feel a lump or mass in the breast, which is usually painless. Changes in shape or size of the breast, changes to skin of the breast, reddening, thickening, or dimpling of the skin. A warm breast, swollen lymph nodes in your armpit or above your collarbone. Nipple changes including discharge, blistering, pain, and inversion, and the entire breast could be painful as well. Here are some photos of what the early signs look like. Here are some other photos of what the symptoms look like. If you're seeing you're having blood discharge from your breast, you want to get that checked right away. Screening and diagnosing breast cancer. Mammograms, I cannot emphasize this enough. It is important that you get your mammograms done. If you're due for a mammogram, you have a family history, try not to miss getting your mammograms done. A lot of women, especially during COVID, had their appointments. A lot of them did not go. They were afraid of contacting COVID or being exposed. Please know that these centers take the precautions to keep you safe and to avoid you contacting any infections at all. So please make sure that you're keeping up with your mammograms. Mammography is what is used to capture an image of the breast using an X-ray. Because the risk of breast cancer increases with age, physicians recommend regular screening for women beginning around age 40 to 50. Though those with certain risk factors are advised to begin screenings at around age 25 or 30. Clinical breast examination. Your providers, when you go to the doctor's office, they'll palpate your breast as well and ask you questions. It's important that you are honest when they ask those questions. Don't be embarrassed. Breast self-awareness. You yourself need to know what your breast is supposed to look like. So when you're in the shower, in the mirror, you want to look, you want to feel, you want to squeeze. And if you're seeing and feeling anything out of the ordinary, you want to report that to your physician right away and get that checked. Here are some pictures of how you do self-breast exam. You can do it. You can look, again, feel, and squeeze. And all you're doing is you're laying, you use your 3 fingers, 2 fingers, whatever you want to use, the arm over your head, and you palpate in a circular motion, or you go up and down, and you check. Doctors may do an ultrasound, or they may do PET scans, or they may do MRIs as tests to try to diagnose as well. Types of breast cancer, there's several types. There's ductal carcinoma, lobular carcinoma, sarcoma, inflammatory breast cancer, Paget's disease of the breast, non-invasive breast cancer, as well as invasive breast cancers. And when you say invasive, it means that it can spread to nearly the lymph nodes, as well as other parts of the body. What are the breast cancer stages? There are different stages. There's stage 1, where the disease is non-invasive. Stage 0, where the disease is non-invasive. Stage 1, the cancer cells have spread to nearby breast tissue. And stage 2, the tumor is either smaller than 2 centimeters across and has spread to the underarm or lymph nodes. Stage 3, at this stage, the cancer has spread beyond the point of origin. And then you have stage 4, the cancer has spread to areas away from your breast, such as your bones, liver, lungs, or brain. And here are the photos of what the different stages look like, what the cancer looked like at the different stages as well. How is breast cancer treated? There are several breast cancer treatment options, including surgery, chemotherapy, radiation therapy, hormone therapy, and immunotherapy, as well as targeted drug therapy. When women have their mastectomies, they tend to bring in a plastic surgeon at the same time, and they do implants. Sometimes they take fat or tissue from the rest of the body and create breast tissues. How common is breast cancer? The American Cancer Society estimates that a woman's chance of developing breast cancer during her lifetime is about 13%. In terms of cancers that affect women, 1 in 3 are breast cancer. In the Caribbean, 23% of breast cancer. Breast cancer is the leading cancer among Caribbean women today. In Canada, it's the second most common cancer that is in Canada. A reminder, being diagnosed with breast cancer can feel scary, frustrating, and even hopeless. If you or a loved one is facing this disease, it's important to take advantage of the many resources available to you. Talk to your healthcare provider about your treatment options. You may even want a second opinion, but don't wait long for that before making a decision. You should feel satisfied and optimistic about your treatment plan. You can join local support groups as well as your churches for support. Support groups that are available to you moving forward: Susan G. Komen Breast Cancer Support Group, NIH.gov, cancer.net, American Cancer Society, and Memorial Sloan Kettering in New York also have great support group. It is also important that those around you love and support you throughout this journey. Despite what the estimates say, fortunately, their survival rates of breast cancer are improving as doctors learn more about the disease and develop new and better approaches to management. I want to give special acknowledgement to the Mayo Clinic, National Cancer Institute, cancercenter.com, Yale Medicine, Cleveland Clinic, Sloan Kettering, which is msk.org, and canada.com. Finally, in closing, Nancy Reagan once said, "A woman is like a tea bag. You cannot tell how strong she is until you put her in hot water." Today, we join on this early birth service to raise awareness about the life-saving importance of breast cancer screening and breast cancer awareness. For all those we have lost, we honor you. To those that have survived, we celebrate you and how courageous you are. And to those that are facing this battle, we stand with you and pray for you. You are strong. You are amazing. You are a warrior. You are a fighter. Don't give up. You will overcome because you are a survivor. Remember to feed your faith with the word of God and prayer. And when you do that, your fears will starve to death. God bless you. Thank you for your time. I hope this was enlightening and helpful. You can feel free to join us in the Zoom room where I'll answer any questions for you. God bless and have a wonderful rest of the week.